200 passengers on board, 5 doctors, and 1 sick child. This is the story of what happened in Vistara UK 814 Bangalore to Delhi flight on 27th August 2023 at 9 pm. Now, I am Dr. Rishabh Jain. This is my wife, Dr. Oishika Chakrabarti, and we happen to be among the 2 doctors out of the 5 who were on that plane that night. Very few professions, I think, give you that self-gratification of saving a life, and especially 20,000 feet above the ground on a moving plane when there is no doctor on board with the limited equipments that you have. And so in this video, I basically want to tell you what exactly were the events that happened, how along with our colleagues, all 5 of us managed to save a 1 year and 5 month old girl child on board that day, and how it really should encourage, motivate others pursuing this profession, and those who want to pursue this profession, that yes, it is a noble profession, and yes, if you put in some effort, you can actually save the life of a child. So it was Sunday night around 9 pm. The flight was scheduled to take off at 9:10 pm from Bangalore airport and was headed to Delhi. It was UK Vistara 814. And once the flight took off, the captain announced that we are on board. The cabin crew started serving dinner, and at around 9:30 pm, there was a distress call that was raised on the airplane by the parents. Now, the cabin crew immediately rushed to the parents and announced on the flight, are there any doctors on board? Now, the 5 of us were doctors. I think Oishika heard the distress call first and she quickly responded. So, Oishika, let's hear from you. What happened? What did you see?
I followed the cabin crew towards the rear end of the plane where usually they sit and they arrange the food, and I asked them, where is the patient? I was looking for a patient, I could not see any, and then they pointed to, like this lady carrying a tiny limp form, and I really did not expect it to be a child. I immediately took the baby from the mother, and the baby was absolutely unresponsive limp. I tried to feel for a carotid. I could not feel a pulse. So I immediately laid the baby down on the floor and asked the crew if they had any medical supplies, any stethoscope, and started with chest compressions.
Right. So at that point, all 4 of us who were still there in the board, we also jumped in. We also went to the back of the airplane, and we saw Dr. Oishika managing and investigating and examining the child, what has actually happened. And as she rightly said, that the patient had a cardiac arrest, and so initially immediately the chest compressions were started. And the cabin crew provided us with the medical equipment that they have. So they have first aid kit on board in case of medical emergencies, and hats off to the airlines for having one. And that medical kit was mostly mostly made according to an adult emergency, in case of an adult emergency. So you can expect a adult size ambu bag and an adult size mask, mostly adult cannulas and adult endotracheal tube, etc. etc. Now, luckily, that medical kit did have a pediatric size IV cannula. So, in medical terms, the pediatric size starts from yellow cannula onwards. So, it was a yellow cannula that they had, and also they had a pediatric size oropharyngeal airway. Now, if some of you know what an oropharyngeal airway is, it is used to prevent the tongue from falling backwards. So, these were the only pediatric equipments that were available, and with the limited equipment that we had, we started with what we knew. Chest compression was started. Navdeep being an anesthesiologist, she assumed the role of a team leader and maintained the airway, put the bag and mask, started giving air to the child. I started doing chest compressions, and somebody started taking medical history from the parents. We found out that the child had a congenital heart disease. So the child had a TAPVC. Now, some of you might know what a TAPVC is. For those of you who don't, it stands for total anomalous pulmonary venous connection. Basically, all the oxygenated blood that is coming from your lungs goes to the right side of the heart, and hence it mixes with the deoxygenated blood in the body, and hence the child turns blue. Now the patient had a heart surgery for this in Bangalore, had a heart surgery 20 days ago, and was flying back to Delhi, and this is when this incident happened. But these things you cannot predict, especially for a cardiac patients. These things you cannot predict, and unfortunately this incident happened, and whatever the equipment we had on the board, we started doing with that. So once the IV line was established, one of us was making drugs with whatever available drugs they had. So they had adrenaline, atropine, and some other important drugs with them. So Dr. Avishala started preparing drugs. There was an oxygen line which was present in the aircraft. So there was an oxygen cylinder also and an oxygen line along with it, which was not fitting into the ambu bag. So Dr. Dharmandeep started improvising it, slitting it vertically so that it becomes widened and get attached to the ambu bag. Meanwhile, Oishika and I were alternating in compressions. Dharmandeep and I sometimes were alternating in chest compressions. And meanwhile, Oishika also talked to the cabin crew. So what did you talk to the cabin crew, Oishika?
So from our assessment of the situation, this baby was very critical, and not just this baby. Any person who is undergoing, CPR will require hospitalization and specifically ICU care in the post-op period. And this baby was it was quite sick. It was a sick baby, and we managed to resuscitate the baby. But despite the resuscitation, where this baby, she went into arrest twice later, despite the resuscitation. So we quickly assessed that we needed to land the plane. The flight had only just started. We were only maybe 45 minutes into the flight, and we had another 2 hours to go, and we did not have that kind of time. So I talked to the pilot regarding this, and we asked what our nearest destination, what were our options where we could land, and we were given 2 options of Nagpur and Mumbai. And Nagpur being the closer of the two, that was only around 15 minutes away. The pilot assured us he could get us there in 15 minutes. Bombay, however, would take near about half an hour, and we decided it was more important to get to the ground and get the baby in a hospital, because like Rishabh said, we did not have an endotracheal tube of the pediatric size. We did not have any monitors. We did not know how effective exactly our resuscitation was, and basically there was more to be desired with respect to equipment, and that was only possible once we got the baby on the ground. So we talked to the parents, and this decision was reached very quickly with the parents, because obviously we know Bombay would have more advanced facilities, but
Nagpur being I think a good city,
it was a good city, and at that time the priority was to basically get the baby to the nearest hospital possible, and we reached a compromise and we landed in Nagpur.
Yeah, so at that point, something that I realized was that as a doctor, we have a big responsibility of telling both the parents as well as the cabin crew and the pilot of what is needed. Because there are 200 passengers are on board, and they are flying to Delhi, and they have their families to go back to, and also for the airlines it's not economically feasible to route the plane to a new destination, and there are explanations that the airlines have to give. But amongst all this, I really like to appreciate the crew, the pilot, and the parents, and all the other passengers as well, that everybody was on board, that there is this 15 months old child and she needs to live, and that is like the most important thing right now, 20,000 feet in the air. And that is something that you can do as a doctor, like convince your non-medicals, your passengers, your other citizens that look, this is something that needs to be done. And a decision was quickly reached that yes, we are landing in Nagpur. The captain informed the Nagpur airport authorities that yes, we are dealing with a sick child, and we would need an ambulance once we land there. And so at the time of landing, so before the landing started, the child was resuscitated on air once, and the child had a pulse. I could feel the pulse in the
There was a
precordial
return of circulation, and even on stethoscope, the pulse could be felt. Even on stethoscope, the baby had achieved a heart rate of around 140 beats per minute. We heaved a sigh of relief
yes.
momentarily.
Yeah, that finally that our efforts have taken fruit, and finally this baby is taking. He's having a circulation. She's having a pulse. But we realized soon that at the time of landing, and this is something we discussed also, that is a critical stage, and both for the passengers, both for the doctors that we are, and as a patient also, that while the plane lands, there is some turbulence, and that might affect our resuscitation efforts. And unfortunately, that happened. That when the plane landed, the circulation again stopped. The child again went into cardiac arrest, and we again started CPR. And I think Navdeep was on the bag and mask, and I was doing chest compressions, and the rest of the team were like clearing everybody out. That yes, we have finally landed, and there is an ambulance waiting outside, just outside the airplane, waiting for us. So quickly we took the child while performing CPR on the way, and in the ambulance, luckily it was better equipped than the aircraft. Definitely there were cardiac monitors on board, there were pediatric size oxygen mask, and a better oxygen supply than the board itself, than the aircraft itself. And so the child again revived on this ambulance, and we again took a sigh of relief, and to our happiness and fortunately that kept steady for a while. The child's vitals were stable on the ambulance, and but we needed to make sure that the child is reached to the hospital safely because before the aircraft again takes off. So another ambulance from an associated hospital of the airport was called in, and they had a trained staff. They had a pediatric size endotracheal tube, and soon that ambulance arrived. The child was intubated, a tube was put inside the child's trachea, and an airway was secured, and the child was transferred to the nearest hospital. That time we all boarded the flight again, like really relieved, really happy, and I would say really satisfied with our profession and our medical careers. I would say like 11 years of medical training, 11 years of medical training, starting from MBBS to MD to SRship to now fellowship, and giving like innumerable exams on the way. Like, you know, one of the toughest exams medical graduates and medicos give in this country. And at that moment, I felt like yes, whatever you do, this is what you're doing it for. Like it is at that time, but when everything made sense. And Vishika talked to the parents of the child before seeing them off. And Vishika, can you tell me about that?
Yeah, it was very gut wrenching. It was very overwhelming because it's a very difficult situation for any set of parents, and this is no less. This is a baby who has a lot of hopes riding on her. She's already had a surgery. She's already had to fight a lot in life, and finally the parents are thinking, okay, now she's in the clear. We have gotten her surgery done, and now we are taking her back home, and this happens.
Right.
And this is I cannot even begin to imagine how gut wrenching it was for them. At the time that we started the resuscitation, they were distraught, understandably, but they looked visibly relieved that at least we are able to get the baby to a hospital now, and they thanked us, and we're really rooting for this baby. She is still sick, she's still in the hospital, she's still on ventilatory support, and
we really hope that the child makes it. And for all the all the medical aspirants, all the MBBS students, and even residents, I would say, who are pursuing residency, like this is something that really motivates you to keep moving forward. Like amongst all the negativity that might be around you, might be around the profession, keep doing what you are doing. Like at the end you are making a difference to someone's life. Maybe whatever happens to the baby, we did give a good fighting chance to her to fight back, and that is what matters. Like all you can do is put in your best efforts at the place where you are with the resources that you are given with. You cannot cry, and you cannot challenge, and you cannot doubt that, oh, I cannot do this, but you have to make do with whatever you have and put in the best efforts, and I think that is what matters.
In the last 11 to 12 years that I have been in this profession, I have, there have been a lot of times where I have felt that I'm in a very thankless profession, and
Right.
we are getting a bad rap for no reason or for some reason. But these are moments that we live for. I think these are
Yeah.
moments that really reinforce at least my faith in my decision of
Yeah.
becoming a doctor, because it's it's not so much about, it is also about the external validation, definitely, but it is there is nothing compared to the feeling of actually uh, giving back life to someone, somebody who would have died if you had not been there, but
Right.
just because you were, that person has a fighting chance and is alive. And just remember that, and the crew and the passengers on board the Vistara, our flight got
Definitely.
delayed by 3 hours.
3 hours,
They were
yeah.
really cooperative, they were really helpful, and it just reinforces my faith in the people also. Yes, there will be one odd guy who will beat up a doctor, but for them, there are 200 such passengers who are
rooting for
behind you, who are
Yes.
rooting you.
Definitely,
rooting for
definitely.
you, yeah.
I think everybody, including the crew, the passengers, all of us, all 5 of us, and the parents as well, they gave us the privacy to do our own thing. And I really like to thank everybody, and hope it motivates the youngsters who want to take up this profession. Do it. It's a good profession. You will feel really good about yourself. It's a very good feeling to have,
Yeah.
that when you save a child and she takes a breath, the circulation comes
Yeah.
back, and it is something that you have brought alive back.